Well, the World Health Organization is warning the Ebola outbreak in the Democratic Republic of Congo is worsening and threatens to spread to neighboring countries. DRC is reporting more than 3,600 cases with nearly 1,600 confirmed deaths. Health workers are struggling to contain the rare Bundibugyo strain. Now, there is no vaccine, but new treatments are in the pipeline.
This pregnant woman voluntarily reported to the Rwampara treatment center after coming into contact with a confirmed case of Ebola. She's receiving her first dose as part of a post-exposure clinical trial. As a pregnant participant, she's also receiving specialized care under a protocol designed to ensure the safety of both mother and child. The study is evaluating two interventions: obeldesivir and a placebo. Participants are assigned to either group through a random selection process.
The treatment is not disclosed to the team at the center. Participants in the trial are monitored for 42 days. They are assessed on the day of admission, on day 5, day 10 and day 21, as well as at regular intervals throughout the follow-up period. Since the study began, no participant has declined to take part.
A total of 24 people have already volunteered for the trial at the treatment centre. A dedicated facility has been established to accommodate participants. Professor Yap Boum says the launch of the trial offers new hope. He also stresses that community participation will be critical to achieving the study's objectives quickly.
This research will help us determine which of the treatments being evaluated can be deployed quickly within our communities. The highest standards of scientific rigor are being applied. What we need now is greater participation so that we can protect people and obtain answers as quickly as possible. The Bundibugyo strain has been with us for many years, yet we still do not have a vaccine or a specific treatment. Now is the time to change that.
As the outbreak response continues, health authorities are urging people identified as high-risk contacts to come forward. They will receive comprehensive care and monitoring free of charge.
The post-exposure Ebola clinical trial is now underway. Anyone who knows they have been in contact with a confirmed case should not hide or run away. They should cooperate with the surveillance teams and healthcare workers.
At the same time, researchers are also testing remdesivir and the monoclonal antibody MBP134 in Ebola patients. Authorities plan to expand the studies across Ituri province, with the aim of finding effective treatments and accelerating efforts towards a vaccine for the Bundibugyo strain.
And joining me now is Dr. Jean Kaseya. He's Director General of Africa Centers for Disease Control and Prevention. He joins us tonight from Kinshasa. Doctor, it's good to have you with us. As we understand it, this is now the largest Ebola outbreak that the DRC has ever recorded, and last week saw the highest numbers of cases and deaths so far. So the question is the response. Is it still losing ground to the virus?
Yeah, thank you. As you said, after 12 weeks of declaration of this outbreak, it's already more important outbreak than the 2018-2020 Ebola outbreak in DRC. It means in 2 years, we had less cases than what we have in 13 or 14 weeks.
Wow.
Yes, now talking about the response, what is making me worried is the complexity of the situation, bringing together insecurity, humanitarian issue, mistrust from community, and also not enough tools, like we still don't have medicines and vaccines. Mm-hmm. I think this is what is making this outbreak more complex today.
Mm-hmm. I want to ask you about a trial that's going on. It's known as the Ebola-PEP trial. And as I understand it, this is not treatment for patients who are already ill. It's an attempt to stop the disease after exposure, but before symptoms appear. Is it working?
Yes, we have a number of clinical trials ongoing. The first one is for the treatment. We are combining two drugs, what we call the Remdesivir and the MBP under 34. And that one, we already enrolled around 15 patients. It's ongoing. We'll see what will be the result for the treatment. But we want also to talk about the prophylaxis one. That can help people who are in contact with those who are affected or infected to have just one pill and to avoid to develop the disease. And this clinical trial is also ongoing with what we call the Remdesivir. It's ongoing, and we hope by September we can have the first result that can help us to say that we have prophylaxis. But we also have a clinical trial on vaccine that started. I think we are moving in all areas of the response for this outbreak.
Yeah, I mean, it does sound promising. Let me ask you, how close are scientists to developing a vaccine against this deadly disease?
Yeah, currently we have 4 candidate vaccines. And we already started with the Oxford vaccine. We started the clinical trial. We are waiting for the mRNA vaccine from Moderna to get the necessary approval from Canada and then to start. And we are also waiting from another vaccine, Ervebo. It means the Zaire strain vaccine that we want also to test to people who are infected with Bundibugyo. I think things are moving. When you have all of these trials moving, it gives hope to people. While we are still saying we need the public health emergency, public health measures to control this outbreak.
Last week, Uganda declared itself Ebola-free. How high is the danger that this outbreak could spread from DRC?
This call, I'm taking that from Uganda. I'm in Uganda, in Kampala today. I had meetings with my colleague from WHO, with the minister, with the vice president, with a number of senior officials from the ministry and the country. We discussed, and we are first congratulating Uganda for the progress they made to control this outbreak. But we are also clear that if we don't stop the outbreak in DRC, maybe we can still have cases coming from DRC to Uganda.
Yeah.
This is why today we said the cross-border activities are important, and also to see how we can support DRC to control quickly this outbreak. I'm flying tomorrow to Bunia, and then I will meet President Tshisekedi on Wednesday with Dr. Tedros, and we can now discuss with President Tshisekedi on all actions that we need to take to stop this outbreak.
Okay. Dr. Jean Kaseya, we appreciate your time tonight, and we wish you all the best. You're doing important work. A lot of lives, we realize, are on the line. Thank you.